Is fasting required before lipid panel testing? Have you ever wondered if you need to skip breakfast before getting a lipid panel test? This is a common question, and the answer might surprise you. Let's break it down. Fasting is generally not necessary for most individuals before a lipid panel test. Recent studies and clinical guidelines suggest that non-fasting lipid profiles can provide nearly the same information about cholesterol levels as fasting tests. This includes total cholesterol, low-density lipoprotein, often referred to as bad cholesterol, and high-density lipoprotein, known as good cholesterol. The differences in low-density lipoprotein and total cholesterol values between fasting and non-fasting states are usually minimal. These small variations do not significantly influence cardiovascular risk assessment or treatment decisions for most people. However, there is one exception to consider. Triglycerides, another type of fat measured in the lipid panel, can temporarily increase after eating. For most individuals, this post-meal rise in triglycerides is modest and does not affect clinical decisions. But if you have a history of high triglyceride levels, especially if you have conditions like hypertriglyceridemia, diabetes, or prediabetes, fasting before the test is recommended. Accurate triglyceride measurement is essential in these cases, since elevated triglycerides are important for assessing hyperlipidemia and cardiovascular risk. From a practical standpoint, non-fasting lipid testing makes life easier for both patients and healthcare providers. It allows blood samples to be taken at any time of day without needing an 8 to 12-hour fast. This flexibility improves patient compliance and convenience. Additionally, it reduces risks associated with fasting, particularly for older adults and individuals with diabetes, who may experience low blood sugar if they fast. To sum it up, most patients do not need to fast before a lipid panel test. However, if you have a history of high triglycerides, or if a previous test showed elevated triglycerides, fasting is advisable. Non-fasting tests reliably assess low-density lipoprotein and total cholesterol for cardiovascular risk. Fasting tests may still be necessary in specific situations or when requested by a physician. Understanding these guidelines can help you prepare for your lipid panel test and ensure you get the most accurate results.